liver and as well as in the gallbladder. So what were the pathologies? I will come to them in details one by one. This is just a nutshell of the slide. As you can see, there was a uterine tumor, which we are quite well known. That is a fibroid tumor in the uterus. In the ovary, there was a benign anechoic cyst, which was not having any septations, luckily. And in the liver, it was a very common thing which we find nowadays. It was a fatty change, which of the grade level 2. And the gallbladder, it was showing contracted. And the lumen was free. It was clearly found in the USG that the lumen is free. But just for your information, I just want to add, contracted gallbladder is one of the precursor or indication of a future gallstone. So it is a USG finding which should not be taken lightly. Next, as I was saying, that multimorbidity is commonly defined as the occurrence of at least 2 chronic diseases in the same individual and having a substantial impact on the individual and the families. And if you see by the statistics, in India, the prevalence of multimorbidity among the women is around 50%, it's 47.69%. And in this case, as I told you, it was a combination of 4 different things in 4 different organs. And multimorbidity can also be a contributing factor to the growing global change with substantial impact on the individuals, caregivers and society, and when associated especially with uterine fibroid and ovarian cyst, it can be the most significant health problems for women, adversely affecting their physical and socio-economic well-being. The etiology, there's a lot of things leading to the slide. I will not go into details because these things we all know that whenever we have this 2 or 3 more chronic illness in the body, it's basically the result of the lifestyle. And if we say in the terms of organon, it's basically the accessory circumstances which we are dealing with. So, so it's the food we intake, the accessory lifestyle which we go by daily, and the types of accessory habits we develop, means including smoking, the alcohol consumption, the caffeine intake, and not to forget about the stress, which is the last and the most important factor, which you cannot come out of it. This combination of multiple factors may be responsible for these multiple chronic situations at one time in one patient. So our treatment protocol for this case, as you know, it was a fatty liver with a contracted gallbladder. For this, basically it's a medicinal and a lifestyle approach where you need to correct the diet, and obviously with medicines it can be controlled. Regarding the fibroid uterus, it's the size of the uterus which is very much important. Generally small tumors in fibroid, especially if it is less than 5 centimeter, which was in the case also. The general guideline is basically to wait and watch if symptoms is appearing or not, because generally small fibroids do not cause symptoms. As we know that fibroid uterus are basically responsible for causing bleeding, which is the most important symptom, and also dysmenorrhea. So in small fibroids, generally the symptoms may not be appearing, but if the fibroid is large, then you may have those symptoms, and accordingly there may be advice for surgery, which may be removal of the whole uterus if there is already menopause, or if there is not menopause, as in this case, myomectomy, particularly removing the fibroid uterus, may be a suggestion as per the allied treatment protocol. And regarding the cyst of the ovary, totally depends upon the type of the cyst in the ovary. The treatment protocol depends upon it. It's maybe from medicinal to surgical as per the type of the cyst. So those were the allied things, and what was particularly in my case and how I went with it, I'm coming to that. So this was the nutshell which I have written, means the conclusion already I have written in the first slide to that. In this report, it was a female patient of 25 years with these multimorbid conditions, and the complaints of the present complaints, if you see, I'm coming to the symptoms. These were the basic 4 presentation of the patient. The patient was having a dull aching pain in the lower abdomen, and it was not specified exactly when it was in the right side or in the middle portion or in the left side. Along with that, the patient was also having excessive falling of hair. Along with that, there was a leukorrhea, but not that much specific except the timing that it was used to occur basically in the daytime. And there was also an increased frequency of urination with a marked timing modality which was around at night. So this was the basic 4 presentation, and already understood from the pathologies which was in the background that the pathologies was not creating the symptoms as you may expect, because as I told you, the fibroid uterus might be presenting with severe bleeding episodes or also may have dysmenorrhea. So this patient was having a dull aching pain in the abdomen which was in the lower part, but this may not be of the fibroid, because if I show you the slide which was related to the USG, you can see that this was the USG reports. Better I show you the slide which I have written so that it becomes visible to you, that the uterus was having a thickness of 6.6 endometrial layer and the size of the uterus was okay, but the size of the fibroid was actually 11.6 to 7.7 millimeter. One small intramural myoma at the right upper posterolateral uterine body is seen. The right ovary, you can see it's around the size of the ovary is a little bit bigger. If you see the normal size of the ovary, it's a little bit bulky. It's 14 to 23 millimeter. Along with that, it has a cyst which was measuring around 31 to 19 in millimeters. It was having a thin wall and anechoic cyst. So you can see the dates. The first USG was done with the patient on 19/7 in 2019, and just 5 months again it was repeated, but the whole abdomen was not done. So in the first, in July when 2019 the USG was done, in the whole abdomen USG we found that there was the fatty change in the liver as well as the contracted gallbladder. But in the next time, after 5 months, when the USG was repeated by the doctor, it was not whole abdomen, it was just lower abdomen, and we could not have the assessment of the liver and the gallbladder. But it was seen that the size of the ovary, the size of the cyst, and the size of the fibroid, it increased within the period of 5 months. So this was enough for the patient to shift gears. I mean, changed doctor, and the patient came to me on first visit in 2020, it was 27th January, and we know 2020 in March, from March, we were all in a phase of a new pandemic. So that was the first visit of the patient in 27th January with this present complaint, and I went with sepia. I went with sepia in LM potency, 0/1 was prescribed. Now why I went with sepia, I am coming to that. So this was the personal and the family history, the mental generals, the physical generals, which I will better explain in this slide. So the present complaints, as you can see, it was there in the patient for the last 6 months. I mean the pain, but other complaints of leukorrhea, the urination, and the excessive falling of the hair, it was there in the patient for 2 years. And regarding the mental generals, a few things were very much prominent. First of all, as you can see in the present complaint only, I have written that the dull aching pain in the abdomen, the falling of the hair, the leukorrhea, none of the symptoms was actually having a marked completeness. Means why it was so, because I remember very clearly that when I was asking, when going through the case taking, the patient was very much indolent, very much indifferent to answer the questions perfectly. Most of the time his answer was coming in few words, no, yes, oh, okay, fine. So he was very much reluctant to answer my questions. He was very much indifferent to my conversation. He was, I'm constantly saying he, sorry. She was very much indolent in her responses. And when I came to know what was the basic reason for this kind of behavior of her, she was just a 25 years lady. And I came to know that from her family that it was a time when the family is having a discussion regarding the marriage. And since then, when his family is thinking about her marriage, she is very much having a fear, a palpitation regarding her marriage, because it's a new thing, it's a new event for everybody's life, and everybody cannot take it that easily. So somehow she was having a lot of fear about the marriage, and especially when I inquired more deep into it, the sexual drive in her was also very much lacking, and she was thinking that this might be a reason which may be a problem later on in the marriage life. And these pathologies at that moment when the patient was there, the pathologies of the uterus and the pathologies of the ovary was creating more and more palpitation. just because she was thinking that this might add up to her married life problems later on. And this was making her very much frightened up and very much indifferent or apathetic to the situation of marriage which was coming up, and which her family was very much concerned at that moment of time. And along with that, he by nature, she was very much introvert nature, was what I found. She was very much introvert in nature, and generally she prefers to be isolated and generally avoids company. And one more thing, there was consolation aggravation was very much prominent in the patient as well. So these things are present in many other drugs. If we go with the materia medica, you will find that this consolation aggravation, this kind of fear, this kind of aversion to company, staying isolation, there are many drugs related to it. But when we will combine all these things, mental generals along with the physical, along with the particular generals, we will come to this drug, and which I can show you in hepatototal analysis also. Later we move on to the physical generals. In the physical generals, the first important thing which I found that she cannot stay in empty stomach for much. Within few hours, she needs to eat. So emptiness of stomach cannot be tolerated by her at all. And perspiration was quite less, and skin was basically on the drier side. And one more thing, that she was very much affected by the change of the weather. She was very much intolerant to cold. Again, this is a very common finding for any kind of sodic and psychotic drugs who have changes from the weather. And one more thing, the pulse was very much hard and pounding. On examination, it was found. And this may be the result of his constant anxiety, constant palpitation, which was in the background. So this was the physical total makeup, and you can see the miasmatic analysis also. And as we all know, that most of the symptoms basically by miasm is covered by soda, as it is in this case also. But you can see quite a few number of symptoms, especially the the tumor growth, the leukorrhea, the type of the pain, that mental few generals are also psychotic in nature. So in a combination, we can say, if we make a miasmatic analysis, that is basically a soda psychotic predominance miasm. So this is the repertorial analysis which I am talking, and quite interestingly, if we focus, that most of them, the physical general, the mental generals are covered by sepia. That one of the important symptoms which is related with the fibroid uterus, you can see that point, that genitalia female tumors, uterus fibroid, sepia is not there. Now, this is the beauty of homeopathy, that we may not need to go particularly with the specific drugs for that particular condition, but we generally go with the totality of the symptom and the essence of the totality, that is most important. So, with that conception, with that philosophy, I went with sepia, and I started sepia on January 2020, as I said. But unfortunately, as you know, that immediately after 2 months, it was a COVID phase, and I lost the patient for the time being. And the patient came to me after a very long time, at the end of the year almost, in December 2020. So I started again, followed with sepia only, means the sepia 0 by 1, 2 was followed by 3, 4 subsequently. And I went with a long series of sepia till...
Sorry to disturb you.
Okay, so I went with this long series until the 15th of 2022, means in the next 21 year, 2021 was totally covered with sepia, and in the middle of 2022, another USG was done, and in that another USG, unfortunately, it was found that the uterine myoma was still there. It was still there, and it was increased in size. However, the rest of the pathologies, means the ovary, it was cyst free, the liver was okay, no further fatty changes, and even the gallbladder was also okay. But the uterine fibroid was increasing in size. So, in this point of time, I couldn't continue with sepia, but I went with a specific remedy here, which is specific, which is very much specific as per Burnett, that is Aurum muriaticum natronatum for fibroid uterus. with 1 potency started, and I landed up with 1 potency after a few months. And then again, when the USG was repeated 1 year after in 23, in June 2023, now the fibroid uterus was also gone. So now it's homeopathy from different angles. Means at times we may require constitutional symptoms, constitutional prescriptions, at times we may require pathological prescriptions as well. But the combination of many things at the right time gives you the right result. So due to the lack of the time, I am finishing it here, and thank you for patience hearing. Thank you.
Thanks to Dr. Partha Pal, the research officer under